So I went to high school in West Massachusetts, and I went to college in Boston, at Boston College, where I majored in biochemistry. And then I worked for a couple of years in the pharmaceutical industry, and I came to New York, attended Columbia Dental School for 4 years. And then I did 1 year of my general residency at New York Presbyterian Hospital. Wanted to learn some more, so I started a second residency program. You can think of it as a postdoc in a department of prosthodontics at Columbia, and it's a 3-year program. I'm in my last year right now. I'm in a program for the PhD in science education at the moment. I think it's as unique as it can be, because as far as I know, there's no other school in the US that actually bring the doctors who are either doctors in training or professors or full-time clinician out of their work and bring into the school where focus is education and teach them how to do their job, I guess, teach them how to teach. And I think we're actually the only school that actually does that in the US, so I think it's as unique as it can be. What makes the program so unique is, if you look at the K-12 education, most of the teachers, they are already trained to be teachers. So a lot of times the focus is on the content, how much content training should they get. And it's completely opposite spectrum in the graduate school. In the graduate school, let's say look at the medical school and dental school, all the professors, they are expert in their craft. They're the masters. And especially in schools like Columbia, we have professors who are noble laureates. So they know their material, they know their contents, they're field experts. But the question is, can they teach? And many can, but as we know, some of our worst courses has been in college and in graduate school. And when you ask them about their identity, many of them identify themselves first as a researcher or as a doctor or as a scientist and not as a teacher. So unlike a K-12 education that we focus a lot on TC, up there it's not about the content, it's about the actual pedagogy and teaching skill. And so this program is an effort to bring that into the graduate school setting. I split my work about half in patient treatment and the other half in dental student education. And I also work in a private practice downtown Manhattan, and of course I'm a TC PhD student. And when I started coming to TC, I didn't expect that would happen at first, but I found out that education, big part of it is human cognition, that you have to think about the student's mind, and you go into their mind and try to find out how their mind works and how to develop it further to maximize their cognitive load. And one of my 3 research interests in TC is cognitive research. And while thinking a lot about cognition, I started actually asking myself again, why am I doing this? And who am I? How do I define myself as a doctor? And why did I start the whole thing? And I kind of started getting the things that I forgot that I once had. And I think it shows because my peers, my family, and most importantly my patients, they started telling me that they started seeing some changes in me, that I look a little more peaceful. So that is, I think, actually the biggest thing that I got from coming to TC and started studying education. Well, I can't say there's demand yet, but there's definitely interest from different departments and from the school on a type of research that I'm doing, what am I doing. So I had a couple of good opportunities to present my research to the different deans at Columbia University and student, second year dental student in Columbia Dental School. It was almost alpha stage, it was prototype. So I was fortunate enough to participate in it, where they selected a few students who were interested in education and started a dual degree program. So we got a Doctor of Dental Surgery degree from the dental school in 4 years, and at the same time we come to Teachers College in the evening and take classes and participate in the community and get a master's degree in dental science education. I think it was developed by Dr. Anderson and Dr. Salentine and Dr. Kleibert at Columbia, and I was fortunate enough to be one of the first few that participated in it, and that's how it all started. There's currently only one person who has gotten a PhD from the dental school. The track that I'm doing, Dr. Rosanna Graham, she's the #1. And then there's second person called Dr. Lauren Zubiari. and I'm the third one. And so PhD is still in science education, just alone. There's no medicine or dental in there yet, but I think they're also working on that as well. It is all about the patient care. Can you solve their problem? And my specialty is in prosthodontics. Prosthodontic is a dental subspecialty that specializes in full mouth reconstruction. So it actually fits tying very well with what I'm trying to develop. That patient walking into you, you look at them. It's not about teeth, not about mouth. You have to see them as a person, and can you address the problem that they have? And I'm trying to combine those two, and that's my main focus interest, to help students better develop that skill. So by the time they're ready, they feel confident, and it ultimately can benefit their patient. To put together a computer program that help the student develop that diagnostic problem skill. Now I'm working on a more robust study that include both quantitative and qualitative data collection analysis, and that will be my PhD research. At TC, first one that comes to mind obviously is Dr. Robert Anderson, and he's been more than a mentor to me. He just has, there's so much, how should I say, the experience and knowledge in him, and I feel I just start beginning to tap into it a little bit. And he has, and as a person too, he has been more than a mentor to me, and he's the reason why I'm here, and I'm continuing to do it. And recently, the names that come to my mind are Dr. Ann Rubit and Dr. Felicia Mensah. Dr. Ann Rubit, because my long-term education interest is in situated learning and legitimate peripheral participation. This is something that I began to start thinking and develop in my mind after talking to Professor Rubit. Felicia Mensah more, of course, she's all about qualitative analysis. She's an expert in that. Before, my research was all quantitative research, where I focus on the exam scores. And now, with the qualitative aspect, data collection analysis, my research is much more enriched. And now, not only I get to see whether the programs that I'm writing are effective, I'm getting an answer on why it's working. And another important aspect is the student enjoying the education. So, and of course, from the dental school, Dr. Salentine, Dr. Marlene Cliver, and Dr. White, George Shelby White, those three are my inspiration that continues, that inspires me to be an educator.